ลับเข้าสู่เวทีฟอรัมกันนะคะภายใต้งาน Startup Thailand and Innovation Thailand Expo 2020 นะคะหัวข้อต่อไปนั้นน่าสนใจอยู่ภายใต้ธีม Transforming Healthcare ค่ะซึ่งเซสชันนี้นั้นโคโฮสต์โดยย่านนวัตกรรมการแพทย์โยธีและศูนย์ความเป็นเลิศด้านชีววิทยาศาสตร์นั่นเองนะคะสำหรับท็อปปิกนี้มีชื่อว่า Remotely Monitor Seniors Health and Safety During COVID-19 นะคะการติดตามสุขภาพผู้สูงวัยและความปลอดภัยช่วงโควิดในช่วงนี้เนี่ยนะคะสปีกเกอร์ของเรานั้นจะมาบอกเล่าให้ฟังถึงอุปกรณ์ค่ะเป็นอุปกรณ์ที่สามารถติดตามข้อมูลด้านสุขภาพของผู้สูงวัยได้นะคะแล้วก็ที่น่าสนใจก็คืออุปกรณ์นี้ไม่จำเป็นต้องสวมใส่อาจจะไม่ต้องมีปุ่มให้กดแล้วก็ไม่ต้องมีกล้องให้ติดตามด้วยนะคะ
นะคะคุณโนอาบริษัท Vallar Imaging ประเทศอิสราเอล
Hello everyone, my name is Noah Sina from Vallar Imaging in Israel. Today we're here to discuss how senior care is adapting to the new normal and how Vallar can minimize the exposure of the senior people without affecting the care that we give them. So this is when we think both of facilities or people that are living in their homes, we're trying to think how do we keep our elderly people safe and sound without exposing them to too many staff members or people outside, and also how do we detect deterioration of the seniors while they're in quarantine or just staying in their homes so that they don't have high exposure. So Vallar makes imaging sensors. Usually when you think of imaging, you think of cameras, but our sensors actually don't use any optics. We use RF technology, radio waves. So we're actually able to also see into materials and through materials and get a very good idea of what's happening in the room without using any cameras or optics. Our technology is one of the leading or most advanced systems of millimeter wave 4D imaging. We have 72 transceivers with 46 antennas on board, giving us many data points. We have flexible frequency bands between 3 and 81 gigahertz, giving us both a very high penetration capability and also very high resolution when needed, all while maintaining a very small, low-powered form factor. So a few of the advantages of radar over cameras in general, before we jump onto the product. So as I mentioned, privacy protecting. So if you want to have a camera in the bedroom or in the bathroom, if you want to be tracking people in the bedroom or in the bathroom without using any cameras, our sensor can actually track the person and see what's happening without seeing any private images. We're also robust, so we can integrate into different types of mechanics, into the walls or ceilings. We don't need the direct line of sight. We have, we're unaffected by weather conditions or lighting conditions, so if someone gets up in the middle of the night in the dark, we can still track them, and also in a very affordable manner. So a bit about Vallar's journey so far. We were incorporated in 2011. We just announced our D round in November 2019 of $109 million. We have almost 200 employees and over 30 patents granted on this technology. Vallar Home is the name of our consumer brand. It was the name of the product before Vallar Home, and I'll talk about that shortly. So the company actually started because the founders wanted to use this technology to tackle breast cancer screening. You can see the picture on the right is our three-dimensional image of a breast with a cancer cell, and the two-dimension mammography on the left. Our technology is non-ionizing. It's not painful. It's a fraction of the cost of mammography, and most importantly, it's mobile. You can it's pretty much the size of a large bowl. You can take it in a backpack to many places that don't have access to large clinics or hospitals, and really get a lot of people to test for breast cancer and just have it more accessible. So this is in clinical trials and going very well, but it will take a few more years until it's actually in the market. But meanwhile, we realized that we can use the same technology for many different applications and in many different industries. So some of our leading industries are senior care and smart home, automotive, retail, and today we're going to focus on the senior care. So when we think about the existing fall detection solutions, we're thinking about wearables, and I think we can all agree that the accuracy is very low in the existing solutions that we have today for fall detection. An interesting fact is that 80% of people that have falls actually don't use their pendants or wearables because either they're just not conscious or they're just very confused from the fall and they won't be able to call for help. Additionally, people don't want to wear the wearables. They feel like it's a stigma and makes them look old. So we were trying to look for a solution that's completely passive, which is how I'm introducing the Vallar Home, which is a revolutionary emergency response system. You can see it plugs into electricity and connects over Wi-Fi, and immediately it starts monitoring and look for both the target activity and fall detection. As soon as there is a fall, it will give a call to the predefined caregiver. That defined caregiver can be a person, a family member, but it can also be the nurse call system at the facility or hospital, and it's 100% automatic, so the person does not need to call for help by themselves. And there will be a call that's conducted. There's a speaker and microphone inside the device, and you can immediately speak with the person that fell and the caregiver. What you can see on the right is the point cloud image. That's actually the raw data that we're receiving. You can see there are no optics involved. We don't see the person, and no private images. We can just detect that there is actually a target and monitor them around the room. So as I said, no buttons, no wearables, and 100% passive and automatic. We've done many testing for this device. We've done many types of falls. We've done testing with pets and automated vacuums such as iRobots and things that could move on the floor. And we have the leading detection rates in the industry, above 97%. What you see here is our facility dashboard. You can monitor multiple rooms all on one screen, and you can see that there's different types of alerts. There's in the room, out of the room, or inside the bed or outside of the bed. So you can actually kind of geofence the person inside the home and be able to track how active they are, how long are they resting, how many times did they use the restroom. And this actually gives us a more full holistic health monitoring system for each person without needing to be in contact with them. We're able to monitor all of this remotely. So if it's your loved parent or grandparent, or if it's just somebody that's in the facility, you're able to see that they're okay in all times from the dashboard without needing to check on them inside their home. Some of the future features that we have are also gait speed and respiration monitoring that are also going to be available in the same sensor. But you can really see that for every person, you can actually see the personal information about them, and then you can recognize when there's deterioration of the situation in advance and offer supporting help and assistance. So what you see here is the Gen 2. It's a smaller device. You can see we took out some of the components, so there isn't the screen that was in the first generation. It blends kind of better into the wall, so you really can't feel it. It can be installed both on the wall and on the ceiling. It has a slightly higher coverage, so it's the coverage is 6 by 6 meters. I didn't say it before, but basically we recommend to have one per room for optimal monitoring. And then we can, and this one can connect to a two-way communication via a central hub. So as I mentioned before, we're adding more features onto this one. So the respiration monitoring and gait monitoring, fall detection, presence in zone, and people counting. The markets we're targeting are senior care facilities, telecare, distributors, nurse call system providers, if you want to actually integrate the product into the nurse call full system, security systems. We can also detect intruder alerts, and it's an extra service that you can offer your secured homes. Insurance companies and smart home integrators for automation, for example. So just maybe a word about insurance companies. We can kind of reduce the hospitalization cost if you think of, identifying the deterioration when it happens, and being able to give the extra help. You can reduce the hospitalization costs. You can get more data on your insured, which everyone would always want to have more data to be able to customize their service. Expand into more markets and stand out from the crowd with really giving the service that's more of a closer watch on your secured. So again, the new normal will be a differentiator for communities. People are really trying to understand how to help the senior care, how to keep them safe and not be exposed to all the caregivers that are coming and going from the facilities. So this sensor is one sensor that can be used in so many different ways to do that, and it's here, it's available, and we're ready to help you with this huge challenge. So thank you so much, and I'm available for any questions that you may have. Thank you.
Thanks to Ms. Noah Sina, Business Developments of Vallar Imaging from Israel. It's a very interesting solution and a very interesting technology. We have a few questions for our speaker. Ms. Noah, I have a few questions for you. As for what you presented, the technology looks really exciting for the aging population. When will you be able to launch in full service?
So we actually launched Gen 1 already. Gen 1 is in the market. We already sold it all around the world. We have sales in the US, in Europe, in China, Japan, Australia, and starting to also look into Thailand now. The Gen 2 is going to production in October. So we already have samples available and should be able to launch fully in just a few months.
So when is your plan to launch the product in Thailand and in other Southeast Asian countries?
So we're already in relationship with a few companies in Thailand and Southeast Asia. As I said, we have samples and we're running some pilots, so we're already ready to start the partnerships. As I said, the production will be in about a month or two, so we're ready to start discussing. We work and get the regulation that's necessary in every country as we start working. And as I mentioned, we spread out already to many of the countries, so we're all set.
That's great. And how do you plan to deal with privacy issues since your products do contain a lot of the user's health information?
So as I mentioned, we don't actually collect personal information from the device. The device only collects raw data, which doesn't have any identification or any personal images. The personal information would go to the cloud level for the application, and that is actually on the cloud that's owned by the customer. So it's not collected by Vallar at all, and we are completely compliant with GDPR. So no privacy issues.
One last question. So this product is actually different from the other products that is actually existing in the market, like Apple Watch and all. It's different in the sense that you don't have to wear it, but it still collects data. Is that correct?
So the difference, I think, is mostly accuracy. The wearables are not as accurate as our solution, and yeah, as you mentioned, people tend to, either forget to wear them, or they don't wear them when they're going to bed at night or when they're showering, and those are the times where the falls usually occur. So what we're actually covering for the times that they don't have the watches, as well as just to give much higher accuracy.
All right, Ms. Noah, thank you very much for that presentation and thanks for the information. Thanks for joining Startup Thailand and Innovation Thailand Expo 2020.
Thank you. Thanks for having us.
เอาละค่ะก็เป็นเทคโนโลยีที่น่าสนใจนะคะอย่างที่คุณโนวาซีนาได้บอกไปคือมันเป็นประโยชน์นะคะถ้าเกิดเราจะมีอุปกรณ์ในลักษณะนี้ซึ่งก็จะสามารถติดตามข้อมูลด้านสุขภาพสำหรับกลุ่มผู้สูงวัยนะคะปลอดภัยใช้ง่ายอาจจะมีความสำคัญมากขึ้นโดยเฉพาะในยุคนี้ในช่วงที่มีโควิด -19 ด้วยนะคะก็อาจจะต้องมีการมอนิเตอร์ข้อมูลทางสุขภาพของผู้ใหญ่ที่อยู่กับเราที่บ้านนั่นเองค่ะก็หวังว่าคงจะได้เห็นเทคโนโลยีนี้ในประเทศไทยในไม่ช้านี้นะคะเอาละค่ะช่วงนี้เราพักกันสักครู่นะคะเดี๋ยวกลับมาติดตามท็อปปิกในหัวข้อต่อไปซึ่งก็จะเริ่มในเวลา 13 นาฬิกานะคะว่าด้วยเรื่องของ Tourism Rebound ค่ะ Sharing and Thailand Tourism เดี๋ยวจะเป็นอย่างไรกันนั้นติดตามกันนะคะช่วงนี้พักสักครู่ค่ะ